Hi there, my name is Sarah Bassiuni, and in this short presentation, I'm going to talk about epidemiology and RSV. So very quickly, so who am I? I am an epidemiologist by training. I'm currently getting my PhD in epidemiology at the University of Michigan. And part of my dissertation is to study transmission of RSV. And just more generally, I'm really interested in understanding infectious diseases and how they propagate in our environment, especially in like social aspects. So now that we've talked about that, now that you know who I am, just a quick outline of what we'll cover in this presentation. First, I'm going to talk about epidemiology. Then I'm going to talk about what RSV is. And lastly, what you can do with this information. And you can follow along in the lower right as we go through each section. So first off, what's epidemiology? So pre-2020, if I told someone I was an epidemiologist, it was not uncommon for someone to be like, oh, you study skin, right? Which makes sense. Like epidermis, epidemiology sound pretty similar. But no, I don't study skin and I'm not a dermatologist. And I think it's helpful to highlight what the modern definition of epidemiology is. And that's studying states of health and disease so that we can recommend changes to improve health in populations. And I've broken it up by the word roots here to kind of solidify what that means. And as you can see, there's an aspect of study, but there's also an aspect of action. Like we want to recommend changes based on what we learn to help improve health. And especially 2020 and onwards, I think epidemiology and public health and the importance of both have been more at the forefront of folks, the mind of folks, especially regarding infectious diseases. Speaking of infectious diseases, let's shift on to RSV. So, since it's such a short talk, I won't have time to really get into all the details of it, but I do want you to walk away with knowing what it stands for. So, respiratory syncytial virus is why we call it RSV because it's so long. But some of the highlights about what this virus does is it's a virus and it's spread by droplets. So this is by coughing, sneezing, the classic upper, respiratory virus symptoms that you might get if you have the common cold or influenza or COVID. And RSV attacks cells in your respiratory tract. So this is from your mouth and nose down through your lungs. So, since I'm an epidemiologist, I really am interested in not just how RSV affects an individual, but what it looks like in a population. And so, if we think of the life course from, baby all the way through to elderly and old age, RSV is found to affect most significantly the youngest and the oldest, so the tail ends of our population. In fact, over 60,000 children worldwide die each year from RSV infection. So, as you can tell just from that number, it is a virus that has a really big public health impact, and that's why we study it. And just, I wouldn't be an epidemiologist who studies social epidemiology if I did not talk about some of the structural health inequities that are at play here. Again, it's a short talk, so I won't have time to get into those details, but I do want to point out there is some limited research indicating that Indigenous infants around the world experience more severe RSV infections. And the research is from areas like Alaska, Canada, the Amazon in Brazil, and the outback in Australia. And this is not necessarily from like a biological inherent difference from, Indigenous infants versus non-Indigenous. This is very likely, if not almost certainly, the result of structural health inequities that are the result of, longstanding colonialism, genocide, forceful relocation, this idea that these are populations that are currently living potentially in very isolated locations that have not, like governments have not put money into providing good care that is easily accessible. So, like if your infant gets sick in January and the nearest hospital is a helicopter ride away, that is far less accessible and far less equitable as compared to like I live in a pretty accessible spot in Michigan. And so just keeping that in mind to understand that RSV is like affecting certain populations more because of these structural inequities. So, taking all of that, whirlwind of information that I just shared with you, what can you do with it? And there are three main things. One is modifying social behaviors, another is vaccination, and a third may be supportive treatments. So for social behaviors, it's probably not unfamiliar since 2020, unfortunately, but this idea around masking up. Masking really does make a difference in terms of disrupting the transmission of RSV from person to person, just like other respiratory viruses, as well as other respiratory diseases. Um, and if you think you've been exposed, so like maybe you were, on a flight and someone was coughing and sneezing next to you for the duration, after that flight, quarantining, meaning that you try to limit your interactions with others so that if you do have like some virus that has been transmitted to you, you're not passing it on further. And then similarly, if you're feeling sick, so if you're feeling sneezy, if you're coughing, if you feel fatigued, if you have that classic constellation of symptoms of a respiratory virus, isolating. So if you can, don't go to work or don't go grocery shopping so you don't further that transmission. I understand that's not always the case, that sometimes livelihoods depend on that. But for those who can, please do so. It really makes a difference and can absolutely save lives. So for those who are in two populations, vaccination is also a consideration. So we have these two vaccinations that have come on the market. One is for pregnant individuals. So if someone is between 32 and 36 weeks of gestation, you can get vaccinated. And the idea here is that you are providing this extra layer of protection for this soon-to-be born child, because when they're younger than 6 months, like that's when RSV can hit and can be really severe if they get an infection. So if you get vaccinated beforehand, by the time they're born, hopefully you've provided that extra layer of protection. And then if you remember that life chart that I showed about RSV affecting the youngest and the oldest most severely, so if you're 60 years or older, you should also consider and talk to your doctor about getting vaccinated against RSV. And this will hopefully help reduce not just like the severity of an infection, but also if you're not infected, then you can't transmit it. And so it's a win-win if your doctor recommends this for you. And then lastly, so I had mentioned that if someone is pregnant, they can get vaccinated. So part of the premise of vaccination, right, is you are boosting someone's immune system. You're kind of activating their immune system to produce these things called antibodies before they get like a true infection. Um, but like little babies don't necessarily have that. Their immune systems are still learning, they're still warming up. And so you can have these supportive treatments provided for infants who are at highest risk of developing a severe RSV infection during an RSV season. And this is something to definitely talk to your doctor about if you are thinking about getting pregnant, if you are pregnant, if you just had a kid, because they will have advice on whether this would be a good idea or not. Especially if the child has a constellation of risk factors. So these are things like premature birth, chronic lung disease of being premature, or congenital heart disease. I threw on the screen here two of these supportive treatments, palivizumab and nirsevimab. These are both, they have been used and they are currently being used. They're both intramuscular injections. And so this is something, again, to talk to your doctor about if you want more details. But just knowing that those are available for certain individuals, for certain infants, may be helpful. All right, this has been quick, but let's wrap up. So what do we talk about? Just a quick review. So epidemiology, once again, is studying health and disease so that we can then make a change and recommend a change to help improve health in populations. RSV is respiratory syncytial virus, which is a virus that's spread by droplets and it attacks cells in the respiratory tract. And it's most, concerning or deadly for infants and the elderly. And what can you do with this? Once again, mask up, stay home, and get vaccinated if you're eligible. Talk to your doctor about various, supportive treatments if relevant. But yeah, definitely do what you can to help try to prevent transmission of this. Thank you so much for listening. I hope you've learned something about RSV. And in the meantime, please stay well and take care.